Hello
Hello.
everyone, Dan from ServoPro here. I've got Damien Gooden from HR Central with me. Damien looks after all our ServoPro members and independent service stations around Australia for all things HR. So welcome, Damien.
G'day, mate. Thanks for having me on. What crazy times we're living in.
It sure is, mate. It's yeah, the world is going crazy, that's for sure. Lucky we've got you here to give us some wisdom.
That's right, mate. It's not as bad as it seems.
No, it definitely isn't. It's all perspective, isn't it? Mate,
It
a
is.
question that our members are asking us that we're hoping you can help us with is, so what exactly are these symptoms that as an employer I should be looking for in my employees with the coronavirus? So what sort of things should I be looking for to know that they, possibly have been infected?
But I think it's important with any health and wellbeing issue with your team to make sure that you're on the lookout for any symptoms that they're not 100%. So before we get into the coronavirus specifics, keep an eye and even check in. Make sure that you know how people are and check in on their physical health, but also their mental health as well, just to make sure they're okay. As far as symptoms, interestingly, there's a lot of people, particularly children, who can be asymptomatic insofar as they don't actually show any symptoms. So people can be carrying the virus and not showing any symptoms. So again, looking for these symptoms is something you should do, and I'll point through those in a minute, but also be aware that maintaining that hygiene, washing your hands repeatedly, washing your clothes if you go outside and those sorts of things is important, regardless of if you feel like you've been near someone who's had symptoms. So that's really important. Dan, I'll just refer to health.gov.au site. Just bear with me for 1 second while I share my screen. That has the key symptoms that we are looking for here. So rather than me making them up myself, as with all information on this topic, I would recommend you go to government websites to get the info. But here you can see fever. Sort of hard to tell if someone's got a fever, but they might get a bit flushed. Cough, very obvious. Hopefully people are coughing into their elbows when they're coughing, regardless of the reason, but certainly the coughing, the sore throat, raspy throat as well, dry throat might be a lead into that, and then shortness of breath. Somewhat difficult for you as a business owner to see a lot of these things in your team. The coughing is probably the main giveaway that's sort of publicly visible, but I would recommend anyone who's not looking 100%, even if they're a bit fatigued or anything like that, if you can talk to them, ask after them, and just see. And as usual, if they need to take leave for personal reasons because they're unwell, then encourage them to do so.
Perfect, mate. That's great. And yeah, I think it's really important that you've been able to tell our members this because yeah, there is some confusion out there of what things that they employers should be looking for. And yeah, I think it's really important that they're aware of the things that they should be looking for so they can take the appropriate action. Damien, thanks for clearing that up for us tonight, and have a good night.
Thanks, mate. You too.